Do you know the symptoms of a heart attack? Or could you identify them if they were happening to you or someone around you? These questions might seem daunting, but they're fundamental. The truth is, understanding the signs of a heart attack is not just about medical knowledge. It's about being prepared to act swiftly in a critical situation. It's about potentially saving a life, yours or someone else's. So let's delve into this crucial topic. Knowing the signs could literally save a life. A heart attack, also known as myocardial infarction, occurs when blood flow to a part of the heart is blocked, usually by a blood clot. This could be due to the buildup of fatty deposits on the walls of the arteries, leading to a blockage. Now, when we think about heart attack symptoms, a few common ones immediately come to mind. Firstly, there's chest pain, often described as a sensation of pressure, tightness, or squeezing in the center of the chest. Then we have shortness of breath, a symptom that can occur with or without chest pain. And let's not forget about discomfort in other areas of the upper body. This can manifest as pain or discomfort in one or both arms, the back, neck, jaw, or stomach. But these are just the tip of the iceberg. There are other symptoms that are less obvious yet equally important to recognize. These symptoms might be familiar to some, but there are other, less known indicators that we need to be aware of. While chest discomfort is the most common symptom, there are other signs you need to watch out for. Now let's dive deeper into the symptoms of a heart attack. We all know that chest pain is a telltale sign, but it's not the only one. So what else should we be aware of? Firstly, nausea. It's not just a feeling of sickness, but an intense urge to vomit. It's your body's way of telling you that something's not right. And yes, it can be a sign of a heart attack. This isn't your run-of-the-mill upset stomach. It's a sensation that comes out of the blue, often without any apparent cause. Next up, lightheadedness. If you're feeling dizzy, faint, or like you're about to pass out, it could be more than just dehydration or lack of sleep. These feelings can be signs of a heart attack, especially if they're accompanied by other symptoms on this list. Now let's talk about cold sweat. It's a type of perspiration that's different from the sweat you might experience after a workout or on a hot day. This sweat feels clammy and cold, and it's often accompanied by a sense of unease or dread. It's your body's response to stress. And in this case, the stressor could be a heart attack. Lastly, we have fatigue. We're not talking about the tiredness you feel after a long day or a poor night's sleep. This is a deep, overwhelming exhaustion that seems out of proportion to your recent activities. It might feel like you're suddenly running on empty, even if you've had plenty of rest. Each of these symptoms on their own might not seem like a big deal. You might dismiss them as just a bad day or a minor illness, but when they occur together, it's time to take notice. And even if they don't all show up at once, don't ignore them. Any of these symptoms could be a sign of a heart attack. Remember, these symptoms can occur individually or together, and they can vary from person to person. So, to recap, the symptoms of a heart attack can be more than just chest pain. Indeed, heart attacks often present a range of symptoms that extend beyond the classic, dramatic chest clutching. You may experience discomfort spreading to the shoulders, neck, jaw, back, or even the arms. Shortness of breath, lightheadedness, nausea, or breaking out in a cold sweat can also be telltale signs. Some people may feel an unusual level of anxiety, similar to a sense of impending doom. While we've delved into these symptoms individually, it's crucial to remember that they often occur in combination. This is not a pick and mix situation. The presence of one symptom does not rule out the others. And remember, the severity of symptoms can vary from person to person. Some might experience them mildly, while for others, they might be intense. The importance of recognizing these symptoms cannot be overstated. If you or someone around you experiences these symptoms, don't hesitate, don't wait. Time is of the essence. Call for emergency medical help immediately. Every second counts in increasing the chances of survival and reducing the risk of long-term heart damage. In conclusion, understanding these symptoms and acting promptly can make all the difference. It's not merely about being health conscious, it's about being life conscious. So, equip yourself with this knowledge and share it with the people around you. Stay vigilant, stay informed, and remember, the faster you act, the better the chances of survival. Knowledge is power.